Hi, my name's Steve, 65 years old, and I had bilateral total knee replacements with Dr. Chalnick about 1.5 years ago. Well, I had had a lot of knee injuries when I was younger and multiple surgeries. And as I got older, those surgeries caught up with me and I started developing a lot of knee pain. As a registered nurse, I'm on my feet 8, 10, 12 hours a day, so it started getting more and more difficult to get through the day with all the walking, standing, and everything that we do. I do work in the surgery center with Dr. Chalnick, so I've known him for about 8 or 9 years, so I've seen his work. I know him as an orthopedic surgeon. I know him, he's a very nice guy, and I know he has a very set regimen, and I really like the way he handled his patients and does his procedures. So we had talked, tried some steroid shots. It bought me some time, but it got to the point where none of that was working, and it was time to schedule surgeries. Well, before I started developing the knee pain, I was very active, into sports, playing with the grandkids, running around. The wife and I out walking, hiking, biking, things like that. But as the knee pain started getting worse, I was unable to do any of those things. Like I said, it got to the point with work, I could barely get through the day. I'd be coming home and I was on the couch with ice packs on my knees, and that was it. I wasn't able to walk, play with the grandkids, do any of that anymore. So there really was very little quality of life from all those aspects. Yeah, so when we came to the decision to go ahead and do the surgeries, it was in the middle of COVID, so we decided to do one knee at a time. I would do one knee, stay overnight in the hospital, go home the next day, and then we would set up the second one for about 3 months later. We did the surgery at Monmouth Medical. They were phenomenal there. I was able to get in about a week or two before, had my blood work, EKG, everything done, met with a nurse who talked me through everything, what to expect, got to meet with the anesthesia team. So I'd met most everybody prior to surgery and knew everything to expect. Went in that day, everybody was fantastic. I feel fantastic. I have not had pain in my knees for over 1 year. It is a very weird feeling after having pain for so long, but finally got used to not having pain. It's just fantastic. You know, a couple of weeks with the rehab, just had to put the effort in, and it paid off. I'm doing back to bike riding, hiking with the wife on the boardwalk, like I said, playing with the grandkids, just, swimming every day, working out in the gym every day again, just everything. I feel, 10, 15 years younger than I did 1 year ago. So. I would recommend you see Dr. Chalnick. Number one, he's a fantastic physician, great personality, outcomes are terrific. He's the head of the department up at Monmouth. Everything with Seaview was fantastic. All the girls that I dealt with, everybody was terrific, friendly, kind. Anytime I ever had a question, they got back to me with answers. They were right there helping me get everything organized, set up before. The visits after were quick, easy. Like I said, everybody was very friendly, very nice. It was a great experience.